Sandwiched between the world's most populated nations and slightly larger than Switzerland, Drukyul, the land of the thunder dragon, is a mystical land almost frozen in time. Bhutan, as the country is known by the outside world, is a Himalayan kingdom still deeply in touch with its roots, while at the same time carving out a modern identity for itself. The country believes that the way to forge ahead is by preserving its unique traditions and culture, ushering in balanced economic and social development, and by protecting its rich nature. About 70% of the total land area is still maintained under forest cover, with about 30% demarcated as protected natural and ecological reserves ranging from the subtropical to the alpine. Little surprise, therefore, that Bhutan today is considered one of the 10 global biodiversity hotspots. While symbols of modern development are easily visible in most parts of the country, about 80% of the country's population is still dependent on agriculture as the mainstay of their life. And the rugged mountain topography makes earning a living extremely difficult. In fact, the biggest challenge the government is confronted with today is bringing development services and infrastructure to the doorsteps of its largely rural population. Since the initiation of planned development in 1961, the government has attached particular importance to the health and education sectors, considered important for fulfilling the ideals of gross national happiness, an overarching development philosophy envisioned by His Majesty King Jigme Singye Wanchuk.
Over the decades, we've had a very successful primary health care program. 90% of the entire country is covered by the health. We have 90% immunization coverage. We have achieved universal immunization coverage since 1991. We have more or less eliminated leprosy. Iodine deficiency disorders are no longer a public health problem. And with vitamin A deficiency is also not a major problem in our country. So basically, primary health care has been a success. In fact, we even won a WHO award, the Sasakawa Award for primary health care. We take it as a great sense of pride and honor for having achieved that.
Financial sustainability, particularly of the health sector, however, remains a major concern of the government. The annual expenditure on essential drugs and vaccines alone exceeds $1.2 million. Important health goals have been achieved in the last 10 years, but many challenges lie ahead. Especially children still face a difficult start in life. To address this pressing concern, the Bhutan Health Trust Fund was established in May 1998 during the World Health Assembly in Geneva.
Health was always His Majesty's priority. And when we proposed to His Majesty, when His Majesty was running the government still, that we cannot sustain health, Your Majesty, let's put a price tag. Let's have user fee. He says, no, absolutely no. I must keep health free for our people. You all have to find way of sustaining it, but we have to keep it free. And that's how the birth of the Health Trust Fund came about.
The idea to create a trust fund was supported by the World Health Organization, and the goal of the trust fund was to raise $24 million through donor contribution, matched by a dollar-to-dollar contribution from the government of Bhutan, and use the interest earned to fund the primary healthcare activities. However, after the initial enthusiasm, contributions began to slow down and had nearly come to a standstill by 2001.
There's been a donor fatigue. Funds were not growing as we had expected. So we needed to do something out of the extraordinary, and to walk from eastern tip of the country to the capital, and that walk also by a minister we thought would make news as well as attract attention and hopefully sympathy also.
In early 2002, the Health and Education Minister, Limposangi Nidup, came up with an ingenious idea to raise money for the Bhutan Health Trust Fund. The minister's idea was to take a sponsored walk from Tashigang, a district in the eastern part of the country, to Thimphu, the capital city in the west. It would mean hiking right across the kingdom along the ancient trail covering a distance of approximately 560 kilometers. 6 officials volunteered to accompany the minister on the trip, and so the preparation began. The health walk team started taking a 2-hour walk every day right till the day before departure. On weekends and holidays, they tested the hills surrounding the capital city and the nearby districts. Early on the morning of September 25, 2002, the health walk team trekked down from the ancient fortress in Tashigang to the starting point of the journey, a bridge over the main lateral east-west highway. Each walker carried a backpack that contained provisions for camping and food ration weighing between 25 and 30 kilograms. Hundreds of support walkers accompanied the team. Others were waiting at the bridge to bid farewell to the team and to make their contributions to the Health Trust Fund.
We will draw strength from your strength. We will draw breath from your breath. And it will give us that energy to reach Thimphu. The positive energy that has been generated by one and all. You will be traveling with us in spirit